Hello, and thank you for joining me. I'm Jazz Harrison, a clinician on the Provider Outreach and Education team with Palmetto GBA. Today we'll be discussing evaluation and management services in the domiciliary or rest home environment, CPT Codes 99334, 99335, 99336, and 99337. A domicile, or home sweet home, is a residence, home, or lodging. Current procedural terminology, or CPT codes 99334 through 99337, are used to report evaluation and management services in a facility which provides room, board, and other personal assistance services, generally on a long-term basis. These codes are also used to report evaluation and management services in an assisted living facility. The facility services do not include a medical component. Comparative billing reports. Comparative billing reports, or CBRs, are reports that show providers how they rank against their peers in the state and nationally in billing for certain risk areas. This report does not contain patient-specific data. The CBR applies to all provider types. The CBR is not intended to be punitive or sent as an indication of fraud. It is intended to be proactive statements that will help the provider identify potential errors in their billing practice. Comparative billing reports. If you receive a CBR, evaluate your agency's billing patterns to ensure the claims are billed accurately. Examine the issue identified in the report to see if there are reasons your agency is an outlier in the data. Evaluate the CPT, HCPCS, or ICD-CM codes used related to the issue in the report to verify the most appropriate code is used. You may receive a call from a Palmetto GBA representative to discuss the 3 questions listed above and provide any other additional information you may have. CBR for domiciliary 99334 through 99337. Palmetto GBA concluded a comparative billing report in the jurisdiction, or JM, Part B evaluation and management codes targeting domiciliary codes 99334 through 99337. These services were billed across 30 specialties and from 4 places of service. The top 3 specialty types were nurse practitioner, family practice, and internal medicine. Top places of service were assisted living facilities and custodial care services. Let's discuss 99334. It's used to reflect the domiciliary or rest home visit for the evaluation and management of an established patient, which requires at least 2 of these 3 key components: a problem-focused interval history, a problem-focused examination, and straightforward medical decision-making. This involves counseling and or coordination of care with other physicians, other qualified healthcare professionals, and agencies who provided care consistent with the nature of the problem and the patient and or family's needs. For example, the staff at ABC Rest Home reports that Mr. Dom has had a temperature of 100.2 for the past 3 days. He is voiding but feels warm and lethargic. They have been encouraging him to drink his favorite apple juice and water, but he only takes a few sips. The MD and nurse practitioner examined Mr. Dom and ordered a urinalysis. Results were a UTI, and the patient was placed on antibiotic therapy. Usually the presenting problems are self-limited or minor. Typically, 15 minutes are spent with the patient and or family or caregiver. In 99335, it's used to reflect the domiciliary or rest home visit for the evaluation and management of an established patient, which requires at least 2 of these 3 key components: an expanded problem-focused interval history, an expanded problem-focused examination, and medical decision-making of low complexity. Counseling and or coordination of care with other physicians, other qualified healthcare professionals, or agencies that provide care consistent with the nature of the problem and the patient and or family's needs. For example, previously Mr. Dom was diagnosed with a UTI. In this scenario, Mr. Dom's decreased intake has not only led to a UTI, but dehydration, an expanded problem, which would require ordering ABC's IV therapy company to infuse a half-liter of D5.5 normal saline. Usually, the presenting problems are of low to moderate severity. Typically, 25 minutes are spent with the patient and family or caregiver. $99336 is used to reflect the visit rendered in the domiciliary or rest home for the evaluation and management of an established patient, which requires at least two of these three key components: a detailed interval history, a detailed examination, and medical decision-making of moderate complexity. Counseling and/or coordination of care with other physicians, other qualified healthcare professionals, or agencies that provide care consistent with the nature of the problem and the patient and/or family's needs. In order to receive credit for an interval history, the provider must document an update on the status of the patient from the last encounter. Usually, the presenting problem or problems are of moderate to high severity. Typically, 40 minutes are spent with the patient and/or family or caregiver. For example, previously Mr. Dom, who was diagnosed with a UTI and dehydration, had a recent urinalysis and follow-up BMP, and they're within normal limits. The staff reports that while the patient's urine is clear and without odor, his PO intake has improved. He is now complaining of numbness and tingling in his left arm. His vital signs display only a slight elevation of his blood pressure since last week. $99337 is used to reflect the domiciliary or rest home visit for the evaluation and management of an established patient, which requires at least two of these three key components: a comprehensive interval history, a comprehensive examination, and medical decision-making of moderate to high complexity. Counseling and/or coordination of care with other physicians, other qualified healthcare professionals, or agencies that provide care consistent with the nature of the problem and the patient and/or family's needs. In this particular scenario, Mr. Don was evaluated with a portable EKG service performed at his bedside to determine the cause of his chest pain. His O2 sats were 88%, and portable oxygen was ordered at 2 liters per minute. There was also a referral for home health services rendered at this time. The presenting problems are of moderate to high severity. The patient may be unstable or may have developed a significant new problem requiring immediate physician's attention. Typically, 60 minutes are spent with the patient and/or family or caregiver. Previously, Mr. Don was evaluated with the portable EKG services performed at the bedside to determine the cause of his chest pain. The referral for home health services was obtained and follow-up care will be performed. Palmetto GBA has references for documentation guidelines for E&M services on our website, along with using your CPT code and a link for those resources. Please visit our homepage at Palmetto GBA JM Part B under Resources on our homepage, down on the left-hand side under Top Links. You can find What's New, and under there, Browse by Specialty, Learning and Education links, and type in Domiciliary and CPT Codes 99334 through 99337 to gain more information. Other resources include our homepage at Palmetto GBA JM Part B homepage, Palmetto GBA email updates at www.palmetto.gba.com/JMB and select email updates. You can also reach provider enrollment services. Click on the link, Browse by Topic, and then Provider Enrollment. You can contact us by email at jmpartb@palmettogba.com. And we have self-service tools at www.palmettogba.com/JMB at the center of the homepage. Thank you for attending today and learning a little bit more about evaluation and management services in the domiciliary arrest home environment, CPT Codes 99334, 99335, 99336, and 99337. This is Jazz Harrison with Palmetto GBA. Thank you and have a great day.